Welcome to Ask the Expert, North Texas, here on News Radio 1080 KRLD. I'm David Rancken.
And I'm Kristin Diaz. Joining us this afternoon is UT Southwestern's Dr. Carolyn Smith-Morris, Professor and Director of the Qualitative Research and Support Services, and Dr. Vlad Zaha, of the Professor and Director of the Cardio-Oncology Program of the Harold C. Simmons Comprehensive Cancer Center here in Dallas. And they're joining us this afternoon because there is a very important cancer and heart health screenings event. It's happening in Southern Dallas. And here to talk to us more about them is the two of them. And whoever would like to start first, let's educate our listeners first on what this cancer and cardiovascular screening, the mission and the hope that this will do.
Okay, I'm glad to take that question. And as a background, and people are starting to become more and more aware that cancer nowadays, once diagnosed early, can be treated effectively, and there is long-term survivorship. But that comes with a cost, the risk of cardiovascular disease, that in long-term survivors can increase 5-6-fold. And that can be prevented by improving the screening and preventive health measures.
So normally you wouldn't expect the two to be linked in any way. How is it that they are linked?
That's a very good question. It goes back to molecular mechanisms of cancer and cardiovascular disease. It goes back to complex treatments that nowadays are available for cancer. So cancer treatments are designed to kill tumors, right? So they are very effective at what they do. The heart needs to work without stopping the entire life. So any damage that happens to the heart or to the blood vessels can cause conditions down the road that can lead to heart failure and sometimes irreversible.
And you all are teaming up with the Oak Cliff Bible Fellowship and the 50 Hoops Legends to host this event. This is part of your research project to promote awareness of heart disease among cancer survivors. Why particularly Southern Dallas?
Yeah, Kristin, this is Carolyn. The cancer rates are pretty high in South Dallas. The ones that we're most concerned about, the highest rates of cancer, are for prostate and breast cancer. And so in working with Dr. Zaha, we're eager to pay attention to those forms of cancer and to get to the populations that have the highest risk for those and for access to care related to those. So that points us to South Dallas. That points the entire UT Southwestern Medical Center toward those areas of health inequity. We want to make sure that we are reaching the pockets that have been underserved. And in particular, for cancer survivorship, we need to get to South Dallas. And that's why it's such a privilege to be able to work with experts like Dr. Zaha to get those screenings into these communities. We've got the new Redbird Clinic in the area. So this event in DeSoto is just UT Southwestern trying to get closer to the communities to get these resources to folks that haven't had access to them before. So we're going to do, we don't have a mammography unit, we'll have that next time, but we're going to do PSA screening. That's screening for prostate cancer for men. We have screenings for other health concerns for women as well. So this is an event for the whole family. We'll entertain your kids while you're getting these free health screenings, and we'll feed you lunch to boot.
What's been the response so far to the announcement that you're going to be doing these screenings?
We are filling up fast. I am so pleased to tell you that with just the tiniest bit of invitation, the community is really coming out. They are eager for this type of screening. Some of them have insurance, but many of them we know don't have insurance. You don't need it to get this screening done. This is this Saturday, December 9th. So we already have 20 of our 50 spots filled. It's looking like you need to hop on that website as fast as you can, or screen our scan code, which is on the radio website, so that you can get one of those appointments. But even if you don't get an appointment, come anyway. We will fit you in. We've got an amazing team of more than 40 of our IT staff, our clinical staff. UT Southwestern sending this wonderful team of folks to make sure we can get you in and out quickly. We're using a really tight intake process that was built during COVID when we did those drive-through vaccines, which is is pretty hard to set up, but I'm so proud and grateful for that team. And that's what we're bringing out to DeSoto on Saturday. So it's a quick screening. It's free. It's a win-win.
You know, Carolyn, it's really great to hear that there has been some engagement already that has been really positive. One of the things that you all educated us on, and Dr. Zaha, you kind of alluded to, was that adult cancer survivors have a 42% greater risk of developing cardiovascular disease, with Black cancer survivors risk being threefold greater. You know, to me, that was just really astonishing. And coming from, you know, being a person of the Black and Brown community, you know, I know just in our culture, going to the doctor, convincing your family members to get, you know, preventative screening can be tough. So I applaud you all in being able to get, you know, such, you know, engagement, as you're saying. How do we continue to break down that barrier and, you know, continue to bring in the younger generation now to get into the habit of preventative screenings?
I think that's an excellent question, Kristin. And together with Dr. Smith-Morris, we have also designed some tools to survey the community on their knowledge, on their preference of learning, on their encounters. What was their experience? How can that be better? And then to learn by that, to create new tools, both for education and for engagement. I think at this point we have the resources on the ground. As mentioned, we have the Redbird Clinic in the area, so the transportation, the access is something that is facilitated by that. And then secondly, we are trying to create this communication closer and to understand the cultural differences between the different groups and how those can be bridged towards increasing the health education, health literacy, and also preventive and healthy lifestyle behavior.
Is there just a sense that there are certain people in different communities that just don't want to know if they're at risk, and so they might not necessarily go for early checkups, that they don't want to know the answers?
I think that is part of certain cultures, right? And it will be also cultural norm as being seen as the strong and healthy, rather than somebody who has a problem and has to see a doctor for that. And but that comes with a detriment, right? We might be acting too late. We might have been missing the point where the disease was controllable or irreversible. And I think that's probably going to be one of the key aspects to change the perception that health is the most precious, right? And any behavior that's related to health maintenance is actually a positive behavior that doesn't diminish somebody's presence as you know, psychologically in the community.
And the fact that it's free, we're already removing a barrier there, whether somebody is uninsured or underinsured, or even the fact that you're coming to the community, that also breaks a layer of the difficulty of transportation. How important was it when you talk about your research of, you know, what went well, what could we have changed, you know, for someone's experience? How important was it to team up with Oak Cliff Bible Fellowship and the 50 Hoops Legends?
Yeah, you've got your finger on it. If your audience listening right now would say one sentence of concern to anybody that might be eligible for cancer screenings, it has a tremendous impact. It has the impact that we're after. So by partnering with Oak Cliff Bible Fellowship and this nonprofit called 50 Hoops, which started as a prostate cancer nonprofit, but has expanded to other cancers, and they're nationwide. We are simply trying to harness relationships that already exist out there. We can't build relationships with every person in the community. That's not our goal. They already exist, and we just want your listener to say one thing to the family members you have. There's this screening on Saturday. please go, or make sure you follow up on those. And when we visit Oak Cliff Bible Fellowship, or we get online to some of these 50 Hoops events, that's all we're doing. We're trying to touch one more person to share that out to their family, because that's what my research shows. I do mostly social science of these medical conditions, and that's where people learn whether to be afraid of screening, or whether, as David was asking, whether this is something that we do all the time. We're just accustomed to this. It has everything to do with who's caring for you and who's encouraging you to go and get these screenings and to get ahead of it. Get the information, even though it's scary, get it before it's too late.
What happens after the screenings, especially if someone comes in and finds out that it might not be good news?
That's again a very good question, David. So what to expect is that the results will come back in mail, in a letter with recommendations, and it will be all the information included, including the results of the tests, but also considering to see your primary care or consult a specialist to further evaluate and interpret, and then get a plan in place. So it's a full circle here. So coming on Saturday for the screening is going to be completed with a result report that will then inform which way to go.
Yeah, and if you don't, oh, I'm sorry.
No, please.
If you don't already have a primary care physician, Redbird Clinic is going to be represented on this Saturday event to help you get one. Or we have not only UT Southwestern cardio-oncologists like Dr. Zaha, but we have some local offices. So we're trying to make sure those links are available to anybody that wants them as well. Just take on the information, take the screening so that we can get to work for you.
From having experience of someone with cancer, I think it's also important to educate our listeners about how lucky we are to have a research institution like UT Southwestern here in the Metroplex. A lot of people, when they think of cancer in the state of Texas and institutions, they might think of maybe MD Anderson in Houston, but we have just as powerful research happening right here in our own backyard. Can we also talk about just the resources available here in the Metroplex?
Absolutely. Simmons Cancer Center is one of the comprehensive cancer centers in a network that goes nationwide, so more than 50 of these, and it is the only comprehensive cancer center in North Texas. So with that, the availability of advanced diagnosis and advanced therapy of inpatient and outpatient resources is available immediately for all the patients in the Dallas-Fort Worth area. And this comes with the opportunity to participate in trials that are designed to lead the edge in understanding and in applying new information for better diagnosis and better treatment in cancer.
Well, thank you so much. One more time, where can people find more information to sign up for the screenings? What's the website?
We're going to send them to your library website. We're also going to send them to the DeSoto Public Library website and invite you again to come out to 211 East Pleasant Road, which is where the DeSoto Public Library is, and we'll get you all of the rest of the information you need.
You got it. And this is happening Saturday, December 9th, this Saturday, again at DeSoto Public Library from 12 to 3 p.m. Dr. Carolyn Smith-Morris, Dr. Vlad Zaha, thank you so much for the time today. We appreciate it.
Thank you. Glad to be here.